So today we are going to read about another topic in the clinical microbiology, that is Mycoplasma pneumoniae. So Mycoplasma pneumoniae is a classic cause of atypical pneumonia. That means it causes a walking pneumonia. Walking pneumonia, why we call this walking pneumonia? Because the symptoms are very mild, but the but there is presence of the pneumonia in the person, and later on I will tell you. If we look at the x-ray looks more worse than the patient symptom. So what is the clinical features of the atypical pneumonia? The clinical features includes the disease is insidious in onset, and there is the headache, and there is non-productive cough, and also there is patchy or diffuse interstitial infiltrate if you see the radiology chest x-ray of the person. So typically it occurs in the age that is less than 30 years old, and commonly it outbreaks in the military recruits and in prison and in the colleges hostels, where there is more crowded place, where there is less aeration and the less ventilation. As I have already told you, the x-ray of the person with atypical pneumonia that is caused by the mycoplasma pneumoniae looks worse than the patient's, and there is high titer of cold agglutinin immunoglobulin M, and which can agglutinate RBCs. The treatment of this mycoplasma pneumonia includes macrolide, doxycycline, or fluoroquinolone. Now, let us talk a little bit about the mycoplasma pneumonia. So, the mycoplasma pneumonia is not seen in a gram strain usually, and it is pleomorphic bacterial membrane contains the sterols for the stability, and it mainly grows on Eaton. So this mycoplasma pneumonia can cause atypical variant of Stevens-Johnson syndrome that is typically seen in children and adolescents. So this is the brief explanation of the mycoplasma pneumonia that cause atypical pneumonia. So typically the symptoms are very mild. I mean the symptoms are very mild compared to what we look at the chest radiographs, and we specifically treat this mycoplasma pneumonia with the macrolides, usually azithromycin. Azithromycin works very well in this atypical pneumonia, and it mainly glows on the Eaton agar, and it is one of the important cause of Stevens-Johnson syndrome, and it is typically seen in adolescents and children. I hope you understood this topic on mycoplasma pneumonia. And from the next video we are going to talk about the different fungal infection, systemic, opportunistic, and cutaneous fungal infection. Thank you.